Hey, it's Tugi talking, and I'm fourth year medical student. Today I'm going to talk about the epilepsy and its basic concepts. Every seizure is not an epilepsy, and epilepsy is marked by sudden, recurrent episodes of sensory, motor, psychomotor experiences due to abnormal synchronous electrical activity of the brain. So if the seizure is recurrent, it's called an epilepsy, and it's not only motor. So about the motor experiences, it could be atonic when antagonist and agonist muscle contract at the same time, and atonic when muscle loses its tone, and clonic is when muscle jerks, and tonic-clonic is when muscle becomes rigid and jerks later on, and myoclonic is group of muscles jerks. And about the sensory experiences, it could be a somatic, for example, just you may feel burning sensation in your hand. Spatial, for example, which is you may see some unformed images. Visceral, for example, which is you may experience the gut feeling. Psychomotor experiences, which is you may taste and smell something which is not there. And emotional change, libido, etc. because limbic system in association with temporal lobe is concerned with species survival and perpetuation. Basically, electrophysiologically, when stimulatory system overfunction or inhibitory system underfunction, whatever the cause is, it results in abnormal electrical activity in the brain. The epilepsy could be a primary and secondary, which results from the other cerebral anomalies. There are simple partial epilepsy, which is consciousness intact and abnormal activity is only in one hemisphere, and complex partial epilepsy, which is consciousness is lost, and if it involves both hemispheres, it's called generalized. Also, if it starts from the partial and becomes generalized, it's called secondary partial and not otherwise specified. Generalized epilepsy could be several different types: grand mal, petit mal, myoclonic, etc. Grand mal epilepsy has 5 phases: prodrome, which is only observed by the others, such as a characteral change, and aura phase, which is only felt by the patient, such as nausea, gut feeling. Then tonic phase and clonic phase, and then post-ictal phase. In this phase, patients become tired, relaxed, angry. Petit mal epilepsy mostly occurs in the childhood and maybe occur 100 times per day. This is the epilepsy like playing pause button. The patient will stop for a few seconds and then resumes. And when the simple partial seizure spreads from the distal part of the limb towards the head, it's called Jacksonia march. And thoughts paralysis, it's temporary paralysis of the limb after Jacksonia march, and usually it resolves within 48 hours. So about the causes of the partial epilepsy is that focal structural lesions such as the tumor, and embryonal dyskinesis such as the cortical dyskinesis, and cerebrovascular accidents, and neoplasms, and trauma, and infection, and systemic inflammatory disease. And about the causes of the generalized epilepsies: genetic causes and cerebral birth injury, hydrocephalus, and prolonged cerebral anoxia, and drugs, and electrolyte disturbances, and kidney failure, hepatic failure, and inflammatory conditions, etc. So about the diagnosis, to conclude and exclude the diagnosis, following studies should have been done. These include CT, MRI, EEG, CBC, serum electrolyte, urine, urea, creatinine, liver function test, etc. About the management, first step is counseling. Explain about the disease and its condition. Warn to not to operate any machinery, for example, don't drive car, and avoid possibly dangerous activities such as swimming, and do not use restroom as locked, and do not stay alone, and avoid exacerbating factors. And secondly, drug therapy and surgical therapy. And now please watch your illustrated seizures play, and I hope it was helpful, and thank you for watching.